My name is Kelsey Stevens. I work here at Anacera as a licensed veterinary technician. I work primarily in the dentistry and surgery departments. A COHAT is a comprehensive oral health assessment and treatment, and that is encompassing all of the dental procedure itself. The dental procedure itself, that includes our pre and post-op exams. It includes the anesthesia, so they do need to be under full anesthesia for these procedures. It includes full mouth radiographs, and it assesses what the bone structure and the tooth roots look like that we can't see visibly on the surface. It also includes scaling and polishing, which means we're getting all that tartar off of the teeth and from under the gum line, polishing those teeth afterwards to try to minimize the etching, the micro etching that happens when you do scale. And then it includes all of our pain medications and things like that. Just like humans, we recommend these dental procedures and keeping the teeth clean because it can affect the systemic health as well. It starts out as just bad breath, maybe some gingivitis. You might have some teeth that need to be extracted because of the extent of the dental disease, but it can affect them systemically as well if you're not careful and you're not taking care of it in time. Radiographs are very important when we're doing dental procedures because there are things that we don't see visually that are problems. There might be a tooth that looks perfect on the surface that we think is absolutely healthy, but we take an x-ray and that radiograph shows us that there is a tooth root abscess that's about to happen. And those can be very difficult to manage just by doing medication, so they do require extractions for most of those. So here we have some radiographs, and this is what we call pre-op radiographs. This is what happens when we first get the patient under anesthesia, and we start by taking the radiographs of the entire mouth. And so what we look at are tooth roots, and we're looking at things for abscesses. Even if we know that there's a problem tooth that we're going in, everybody gets full mouth radiographs pre and post. If we do extractions, they get the post radiographs. And if they don't have any extractions, they just get pre-op radiographs, but every patient gets them. Anesthesia is super important when it comes to these COHAT procedures because we cannot fully evaluate the teeth while they're awake. It's not like you going to the dentist and the dentist says, keep your mouth open wide and I'm gonna do all this work in here. We can't do that the same thing for dogs and cats. So they do need to be under full anesthesia, not just on mild sedation. Anytime we have to do x-rays, the probe has to go in their mouth a certain way. We can't keep them awake enough, to be able to do that. As well as cleaning the teeth, we do go under the gum line, which it can be a little bit irritating to the gums, and they are not gonna sit still for that sort of thing. We usually recommend that you have the teeth assessed at least yearly by your veterinarian. They can assess the teeth and tell you whether or not they're ready for a dental procedure. There are some patients that, because we know the extent of the dental disease, we recommend them having procedures every 1 to 2 years. There are some animals that can go years without having a dental procedure ever, and it just depends on the genetics, the breed, the size, and things like that. Here at Anacera, we're happy to help either have the cleanings done, to help you educate, to learn more about these things. So you're welcome to reach out and contact us about scheduling a procedure or to your local veterinarian.